we're actually going to be I'm going to be asking you to ask me questions. So if you've got a question about your animal, whether it's a cat, a dog, a horse, anything like that, then start asking. Yes. So I've got some questions prepared from people that have put some questions in through via email. So I'll definitely answer those. But yes, if you're actually got any questions of your own and you want them answered by a veterinarian, then now's your chance. So if you haven't met me before, I'm Dr. Leigh and I run Your Vet Online. And Your Vet Online is a 24/7 veterinary service where we provide consultations to you and answer any of your questions about your animals. We can also provide options for treatments and we can provide scripts. So it's a pretty good option for you. If you're ever looking, it's yourvetonline.com. And yes, as I said, we answer all your questions about any animal. So whether it's a cat, dog, might be a rabbit, might be a horse, we've got vets that can answer your questions there. And we're available 24/7. All right, so let's get started. I do have a few questions that I've had to sort of paraphrase so that I could fit them into the little screen here. But I had a question from Sarah, and she's got a dog that has been on fluoxetine for quite some time, and he's doing great. He's doing really, really well. And she was wondering whether she could wean this dog off the treatment. Now, just so that everyone's aware, fluoxetine is a drug that we use in used in humans as well as animals, and it's used when animals have anxiety. That could be a situation where it's separation anxiety. It could be anxiety being around other dogs. It could be anxiety even related to eating or things like that. It could, sometimes it's also used when dogs have issues with other dogs, so they're not too friendly. Maybe they get stressed out about certain things. So it's a drug for our animals when they have a mental health problem. We also use this in cats, and sometimes if a cat has an issue with peeing outside the litter box, or they have issues with always getting a blocked bladder, something like that. Often that's related to stress. As you know, sometimes it can be really hard to tell why a cat is stressed. And so anyway, sometimes what I'm trying to say is we use fluoxetine when our animals have a mental health issue which stops them being able to cope properly with life. And so, can you take your dog off it? I always say to people when they ask this question and tell them that, we've got to consider that mental health disease is like any other disease, like, say, diabetes, for example. And fluoxetine is equivalent to having something like insulin. So if your animal is receiving this because they can't cope, 9 times out of 10, it's a treatment for life. However, sometimes with certain animals, we might just need to pop them on a medication like fluoxetine while we're in that learning stage of learning new behaviors, of learning how to cope. So for an animal that might be going to a new place, they're very anxious, they really can't cope, they may have some separation anxiety, as I said earlier. It might be a situation that we put them on this medication for a while, we do all the behavior modifications that we need to do to get them used to their new environment, or to get them used to being alone, or whatever it is that we have to do with them. And then we might be able to trial them without the medication and wean it off really slowly. The issue here is that you need to do this under veterinary guidance. It's not something you do willy-nilly off your own bat. You always need to talk with someone about doing this, because we can put animals straight back to square one if it's not done properly. So always keep that in mind. So while it might be possible, it's not a clear-cut answer. We need to know more. And if you're thinking about this with your animal, then definitely consult your veterinarian or give us a ring, or use our system at your vet online. All right, let's see. Doreen, what's your message here? Let's see. Hi, my Shih Tzu has very red eyes and he's been on Lubrithel eye gel, but they're not getting any better, and I'm just wondering what else I can do. Okay, Lubrithel. I'm just wondering, I'm not aware of that brand name. Sometimes things have lots of different brand names. I'm blind looking at that. I'm not blind looking at my phone. Very frustrating. I'm just going to have a quick make sure I can see what the active is for Lubrithel so I know what I'm talking about. Okay, it's just a lubricator. Okay, well, that makes sense. All right, so often with the Shih Tzu breed of dog, they often have very bulgy eyes, and they often have a immune-mediated problem called dry eye. And if that's the case, then we actually need to do some tests to work out whether that's the situation. And the test is very simple. We put a special type of paper just in the corner of their eye, and then we measure how long it takes for the tears to be produced and go all the way down to a little mark, and that gives us an indication whether your dog has dry eye. I'm assuming your vet's done that. If they haven't, perhaps it's time to give that a go. Often we do things in stages. We don't jump to all the big things straight away. So it doesn't mean they've done anything wrong. It just means that this is the next step. So in this case, if you were to do that test, then and your dog is diagnosed with dry eye, then there are other medications that we can put them on that are basically immune modulators, and so that it helps your dog to not react and not have basically dry eye. So my next thoughts for this one would be you need to go back to your veterinarian, because we can't do this over an online consult because you need to have a test, and you would ask them to test for dry eye. Unless, of course, there's something else going on there and your vet has already prompted you with something else, go with what they say. But I guess that's the next step, that from the very little information you've provided here, that I would be considering. Okay. Laurie. My Pitty doesn't seem to drink enough water. She's about 8 and we've just adopted her. Otherwise, she seems fine. She just hardly ever drinks. Yeah, it can be hard to tell when dogs are drinking sometimes, as long as you've got plenty of areas where she can get a drink. So for a big dog like a Pitty, I would actually make sure she's got a bucket of water outside, so that's always full, so she can get it whenever she wants. Make sure she's got one inside as well and nice and full. And the thing, I guess, is that if she wasn't getting enough water, you'd definitely know, because she wouldn't be very well. So I often say don't stress too much about these things. Now, if you really, really, really think that she's got a problem here, then the only way to tell is to actually measure. So that can be pretty hard, especially if you've got lots of animals in your house, because it's very hard to tell who's drinking what. So I wouldn't recommend doing this if you have more than one animal in your household. But if you've only got her, then you could potentially measure how much water she's got in the bucket outside, or the bowl outside, the bowl inside. Measure how much, so you put it, let's say at 8 a.m, you fill it with 1 litre in each, something like that. And then at 12 or 8 p.m. that night, 12 hours later, then you can measure that amount again and see how much is missing, and that's how much she's drunk per day. And then you can work out whether that's enough for her weight and her size. can't remember off the top of my head what the calculation is. If you are absolutely intent on doing this, which I wouldn't bother, to be honest, not unless she's sick. And if she's sick, she really needs to go to the vet. But if you're absolutely desperate, pop me down a note and I'll dig up the calculation for you. It's just not something that my little brain can remember. So we can't remember everything all the time. All right, so I hope that helps there, Laurie. Okay, if anyone's joining us, I'm Dr. Leigh from Your Vet Online. I'm just answering your questions. First of the month, first Tuesday of the month, every month, we'll do a free-for-all. Every other Tuesday, I do a little topic. So make sure you join our mailing list, because I'll put out what my topics are for the coming month. And then you can put them in the diary so that you can join in if you've got questions. Or you can send your questions in so that I can answer them in the little tutorial. They're always up on Facebook. They're always up on YouTube. So you can always go back to it at a later date, so that even if you can't make it and you've got a question you'd like asked, just send it in, and then I can, and then when after it's live and showing again, you can go in there and have a listen and find your question. All right, no worries, Laurie. Let me see here. I've got another one from Celia. My dog had a seizure, and what does this mean? So there was a little bit more to this question. Celia was concerned because her dog has been having seizures. He's on a medication. The medication, he's only on one, and it's a medication called Keppra, and he's still having breakthrough seizures. And what does this mean? Now, I don't know how old your dog is or anything else, so it was basically a very brief question, so impossible for me to give a good guideline here. But I just wanted to have a quick word about seizures. So if anyone's listening and their dog one day has a seizure, then you might have some ideas about potential causes and what we do as vets to diagnose it, etc. So basically, a seizure occurs because there's an upset in the chemical activity, electrical activity, electrical activity in the brain. And basically it goes beyond a threshold and the dog seizures. Now, different things can cause that. We know that toxins can cause that. We know that some drugs can cause this. And when those toxins or drugs, what that does is it lowers the threshold for seizure activity. So your dog was probably always a little bit susceptible, and now they are just showing those signs because they've either eaten something or taken something that has caused that. The other thing that can cause seizures, of course, are tumours, and we often see that. So with any dog or animal that is pretty much over 6 years old, we often recommend an MRI or a CT scan. And that's because once we get to sort of that age, then we're heading into that grey area of when tumours start to show their ugly head. And often a dog may have seizures with that. And sometimes those tumours can be primary, meaning they are actually a brain tumour. And sadly, some are actually caused by secondary problems. So a cancer from somewhere else has actually spread to the brain, and now we're seeing those seizures as a result. Now, when your dog has one seizure, we often don't, you might find that a lot of vets don't get too excited. And that's because sometimes, for some reason, an animal might just have one seizure. So often, depending on the age of your animal, if the animal is very young, it could be a sign that it's something like epilepsy. And then there's that sort of grey zone. So you might go to the vet, they'll recommend some bloods, and we're looking at to look for things that are metabolic problems that could potentially change that threshold and or may change the metabolic reactivity of the body. We're also looking for things like potential toxins that could cause a change and give us a hint. We don't really measure toxins as such, so we're not going to go in and try and find a toxin, but we are looking for signs that that could have been the problem. And also we're just making sure that there's nothing else going on that could potentially cause this. So if we did a blood test and we saw lymphocytes are sky high, then we find some lumps or lymph nodes increase in size, then we might be thinking, we've got something else going on here, so we need to investigate further. So one seizure, I guess we kind of say the rule of threes, I was going to say. So if your dog has one seizure and it doesn't sort of happen again, then we don't place too much concern on it. But if it's occurring more than 3 times in, say, a sort of 24-hour period, if it's going on for longer than a good 2 or 3 minutes, that's quite a long time. So if your dog is seizuring and it's not stopping, then you need to go to the vet. But also if it's happening more often sort of than every 3 months, like it has a seizure every 3 months, we can sort of cope with that. If it's happening more frequently than that, then we often have to put them on some medications. And when we put them on medications, often depending on the severity and what we've had to do with the dog, depends on the type of medication we choose. And so often we start with one, and then if we keep having breakthrough seizures, then we might have to either up the dose of that one until it reaches a certain threshold and we can't go any higher. And then we might have to think about adding in other medications. So it's not the end of the world. It just means we have to go back to the vet or, and have a consult, explain what's going on and take it from there. And seizures, just in animals, just like humans, it's not the end of the world. We have got medications for them. And, dogs can live and cats can live a very healthy, happy life on medication. So it's not, I just want to stress that, it's not the end of the world. Let me see here. So if you've just joined us, just ask if you've got any questions. I'm Dr. Leigh, I'm a vet. So yeah, definitely if you've got some questions, pop them down below and I'll get right to them. Okay, Pavithra, my dog has been and again, I know a little bit more about these, but just had to write it a little bit shorter so it would fit in. But my dog has DCM, what should I feed? Okay, so Pavithra didn't actually tell me what kind of DCM their dog had. So there's 2 different types. There's one that's sort of a primary DCM, and DCM is dilated cardiomyopathy. And the primary type is actually due to, it's kind of a genetic problem actually, and it's often in golden retrievers. And unfortunately, it's something that we have to manage with medications, and your dog is not likely to get better over time. We can definitely manage it, but it's not, and they can have a nice, good life, but it's not something that we can fix as such. And as far as what you should feed with those sorts of dogs, that really depends on some of the signs that we're seeing in those dogs. So they might be having a few issues with fluid overload, all those sorts of things. So it might need to have a special diet. So this is something you actually need to talk to with your vet, because we need a lot more information about what is actually going on with the animal. However, there is a type of DCM or dilated cardiomyopathy that is caused by feeding boutique, exotic, or grain-free foods. So in dogs, this is often those diets that are made by marketing brands. They haven't done the research. They don't keep good quality control, and they don't do diet trials. And so we're seeing a lot of these types of cases, particularly in the US. And remember, we see more in the US because they've got more dogs. But we have actually seen this in Australia and New Zealand as well. It's just we don't hear about it as often because there's not quite the volume of animals here. And we don't have some of the the really, and I'll say, bad foods that some of these brands are making over, that are causing some of these problems over there. What I will say is that no one knows exactly what the issue is with these diets. There are lots of studies being done. Originally, it was thought it was taurine related. Just because a diet has taurine in it is not going to solve the issue. And unfortunately, we also, it's a bit of a mystery. So I guess where a lot of vets sit is that we're of the premise, do no harm. So it's always wise. We know that there's a problem with grain-free diets and boutique exotic diets. So you're better off not feeding them. So those are diets that have got peas, legumes, all those sorts of grain-free things as their main components in their ingredient list. There's something in those types of ingredients, in their nutrients that those ingredients do, that is causing some sort of issue. And it's really annoying because we don't know the answers. So rather than put your animal at risk, you're better off not feeding them at all. But the thing is, if your dog has been diagnosed with secondary DCM due to one of these diets, taking them off this diet can help. And that's if it hasn't gone too far, because we have seen sudden death with a lot of these animals. So if you're feeding one of these diets, I recommend you take them off. Consult with us or with your vet. We can have a look. Is your dog on it for a particular reason? If there's no reason, then why feed it? Do no harm. And then put them on a good quality kibble, or plus or minus meat, and get them off that. Now, also remember, we've also seen cases of this with raw diets. Again, we don't know why. So I can't stand here and sit here and tell you it's because of this ingredient or that ingredient, aside from the fact that we know it's very much related to anything that's grain-free. But yes, so difficult question. No hard and fast answers without more information. But if you have a dog that you're concerned about, definitely give our vets a call. We can definitely help you with a bit more information. We'll take you through what we need to know to make some of these decisions. And hopefully we might be able to help you with that. So if you ever need a vet, yourvetonline.com, where our vets are available 24/7. So that can help you out there. So if you just joined us, if you've got a question to ask, pop it in the question area and I will get right to you. These are some questions I prepared earlier because they came through via email. I've taken a lot of the information out, otherwise it wouldn't fit on the screen. But so Paula asked, she said, my cat is straining to urinate. What can I do? Now, her cat was a male cat, and whenever I get this question, I really cringe, especially when it comes in via email, because male cats in particular, any sort of straining to urinate is a sign that their bladder might be blocked. And for some reason, with the male cat's anatomy, they have this little kink where the urethra goes around, and stones like to lodge in that area. And there is nothing you can do at home. There are no home treatments that you can give that will help your cat. So if you have a cat, especially a male cat, that is straining to urinate, you must go to the vet. Don't be using an online vet service. I get a lot of people coming and asking, and I've got this happening, and when it's a male cat, I find it very stressful as a vet because I can't do anything. You actually have to go to the vet. So if you've got friends with male cats, please just share this little snippet of advice. If they're ever straining, if you think it's constipated and there's there's just no urine coming out, you need to go to the vet ASAP. Sometimes with a female cat, if they're dribbling urine or the urine's red or something like that, they still need to go to the vet. Like, it's not something you can fix at home, but you might have a little bit more time. So it might be, if you notice she's dribbled some urine at night, you could wait until the morning to go to the vet. But if there's a male cat and it's 9 o'clock at night and there's no urine and they're straining or licking their bottom, or if they're too fat, they're licking their back legs, because I've seen that a lot, fat cats who can't quite reach and they're licking. And that is often a sign that they need to go to the vet because they've got a blocked bladder. Sometimes you can feel it yourself, but if you're not too, if you've never tried that before, it can be hard. But it's one of those things that, you can put both sides of your hands on their belly and with a bit of firm pressure, and just see if you can feel a ball in there. If you can feel sort of a grapefruit-sized ball, that means you're hopping in the car and getting to the vet very fast, but it doesn't mean you're not doing that if you can't feel it. So, yes. But any cat that's straining to urinate, it is a medical emergency. It's really important that you get help. Okay, let's see. We've got another question here. Oh, yes, this was from Tracy. And she said she had her dog is 3 weeks pregnant and has got a bloody discharge. Yeah, this is not a good sign. So remember, if you've got a bitch that's pregnant and any sort of discharge coming from the vulva during that pregnancy should only be clear. And even then, the only discharge should be towards the end of the pregnancy, around the time when she's actually going to be giving birth to the pups. So remember, pregnancy gestation period is about 63 days, give or take each side. So 58, 68, 70 sort of days. If you're seeing any sort of strange colored discharge, so if it's brown, if it's red, if it's browny red, if it's green, and she's had no puppies, so this is before any puppies are being born, then you need to go and get her checked out. If she's started straining and she's actually in labor, I know she's only 3 weeks old, but if your bitch is in labor and she hasn't had a pup yet and you're seeing any of those colors, especially like a green or even bright red, so proper blood, then it's wise to get to the vet ASAP, because it can mean that you might have a ruptured placenta and those pups are at danger of actually suffocating, which is not a very good thing. So just be mindful that that can occur. So basically, any sort of discharge, if it's not clear, then there's an issue. And if it's bloody discharge, that's a concern, because it could mean, she's got an infection there and you need to get that. You need to get that sorted. Right, I know there was a question that was written on the site, but I can't see it on here. So I'm just going to, I wonder where this person wrote it. Interesting, because I saw it on, how bizarre, here we go, no, interesting, oops, I saw it, don't know why that's playing, let me see, where did I see it? Okay, it was put somewhere else. Okay, hi there, how often would you do an ovary sparing hysterectomies and vasectomies on dogs? I'm not quite sure what you mean by that. Wandilla. Oh, Wandilla, you've asked this question in a different way before. Once you've done an ovary, like a hysterectomy or a vasectomy, you don't do it again. So I'm not sure on the same animal. if you're asking me if I've ever done any of those surgeries, I haven't done them myself. So I haven't got any experience personally in doing those surgeries. They're not that common in Australia. I know that they're a lot more common in Europe. In particular, the whole premise by leaving either the ovaries or the testicles there is that the dog can't get pregnant or sire offspring, and then it's able to grow, and it will have all those hormones that will help with puberty, will help with building muscle, everything like that, but they just won't be able to have babies. And so a lot of people are thinking about doing it for that reason. So you have some breeders that don't want their dogs being bred. They obviously don't trust the people that are buying them. And so they want to do this at a very young age. There are issues, not so much with the vasectomy, but definitely with the ovary hysterectomies, the ovary sparing hysterectomies. If you leave a little bit of anything, then you can have issues. But it's, I don't know. It's not something that's common in Australia. Ask your own vet. Ask them whether they're doing it. They might recommend it. It might be good for your situation, but it's not something that I recommend doing personally, because I would rather the animals stay intact properly until puberty, or whenever we think we're going to need to de-sex it, and then do it then. All right, what else have we got here? I think there was another. Was there another question? I don't know. Okay, any more? Let me see. Doesn't look like there's any more questions. Well, thanks guys for listening in. We are to do a free-for-all every first Tuesday of every month. And then on the other Tuesdays, we have a topic. So join our newsletter, because I'm going to actually put out a timetable of what topics we'll be covering. You can send in some emails with your questions. If you've got any questions you'd like to ask, then you can watch them at your watch the lives either live and ask a question, or if you're not available, send the questions in, and that might help. Otherwise, I hope you guys got some value out of that. There might be some things that you learnt, and yeah, if you need a vet 24/7, our vets are online. We cater to all animals: cats, dogs, horses, pocket pets, farm animals, so cattle, sheep, anything like that. We provide advice. We provide treatment strategies. We can also provide scripts if you're located in Australia and you meet certain requirements. So yeah, go and check out the website. If you've got any questions, let us know. And you guys have a great Tuesday. Thanks for listening, everyone. And we'll talk to you later. Bye-bye.